This KDA Video Minute is brought to you by the endorsed programs of ADA Business Resources, meeting both your personal and practice needs. I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Friday, February 3rd. Well, we missed you last week because we were at our 16th Kansas Mission of Mercy in Manhattan, where at the National Guard Armory we treated about 1,050 patients, totaling about $1.1 million. Now I'll tell you, that's the fewest patients we've ever treated, and that's a good thing. We were able to treat everyone. We didn't have that normal push at the door where we just had to turn people away. We let people trickle in and we treated them throughout the day. So we're very excited about that. As a result, we were able to provide more services to those individuals. So really on a per capita basis, we really provided more treatment for each one of those people than we did in the past. So next year we're still working on the dates and location, and we'll let you know for KMOM 2018 as soon as we have that information to pass on to you. Thanks to all our volunteers. So coming up next week is our Dental Day 2017, so that's on Thursday, February 9th. Again, we really want you to come to Topeka and help us work on our legislative platform, talk about dental therapists, talk about non-covered services. So please, if you haven't signed up, please make that happen. We'd love to have you. We're working on a packet of information to provide the participants ahead of time. You'll get that information the day you arrive as well, but so you'll have a chance to take a look at some of the information and talking points before you get here. So we would love to see you on Thursday, February 9th. Also on February 9th is our Board of Delegates meeting. So if you are on the Board of Delegates, boy, we really need you. We want to make sure we have a quorum. We'll be meeting in the afternoon of the 9th after our luncheon that we have with legislators. So please plan to attend next week. Okay, all this talk of legislation and the Kansas legislature would not be complete without talking about dental therapists. Last week was the Dental Therapist Advocacy Day. There were a lot of hygiene students, frankly, and they made the rounds. So we really, again, need your participation in sort of setting the record straight with regard to legislators that they may have talked to. So legislators, when they come over for lunch, they always are looking for folks in their district, in their area, their hometown. So please, the more we can have, the better. Bring your staff. We'd love to have spouses, staff, whomever that would be willing to come and support the cause. On Wednesday, just 2 days ago, we did have a hearing on our non-covered services bill. That's House Bill 2119. Dr. Dave Hamill and Dr. Nick Rogers and myself all testified. Now remember, back in 2010 we passed a bill that made it so a contract with an insurance carrier could not dictate the cost or the price, the fee that you charge for procedures if those different procedures were not covered by the insurance company. What we're working on this year is putting a de minimis clause in the bill, which means that an insurance contract couldn't cover many different services at a very low fee, so we're making that illegal. And then also we are adding that once a patient maxes out their benefit, at that point they would be considered non-covered, and then you could charge your normal usual fee to that person. So we're working through that a little bit with the committee. We had to make some amendments on the bill, so we're still kind of trying to work that out, but we'll be talking about that at Dental Day as well. So again, if you're interested in that issue, we'd love to have you at Dental Day next week. As I conclude today, we're going to remind everyone that February, as it is every year, is Children's Dental Health Month. So the KDA is working with school districts and schools across the state to have a coloring contest for third graders, as we've done in the past. And then we also sponsor a classroom program where we encourage those classrooms to get together and put together a little project that promotes oral health. So we'll review those and actually vote on the winner during our annual meeting like we have the last couple of years. Now, there has been a packet of information that's been sent out to all the schools, so they have that information that they need. We will be sending some information, or actually I believe we have sent you information earlier this week, emailed to all the dentists to provide them some resources as well. So we certainly encourage you to get in your schools, have your staff go to the local schools, work with them and promote those different programs. And if you need additional resources, whether it's posters or videos or things like that, please contact the KDA office, and we would love to work with you and help you out during this Children's Mental Health Month. Thank you very much for your attention today, and have a wonderful week.